Opioid overdose death is preventable. Opioids include prescription pain medications and street drugs such as heroin and illicit fentanyl. You're at a higher risk for an overdose if you had a prior overdose, have a history of mental health and substance use disorders, mix drugs with opioids such as alcohol, benzodiazepines, cocaine, and other substances, have not used drugs for a period of time because you were in jail or in a detox facility and experienced a change in tolerance, taking higher dosage of opioids or on long-acting opioids. However, with a few steps, you can take action and save a life. Action means arouse the person, check for signs of overdose, telephone 911, intranasal or intramuscular naloxone, oxygen, naloxone again. If you suspect an overdose, first arouse the person with the 3 S's. Shout the person's name and shake the person firmly by the shoulders.
Ned, honey? Ned! Come on, Ned! Ned!
If there is no response, do a sternal rub.
Come on, Ned!
Ball your hand into a fist and rub against the breastbone of the person.
Ned, wake up! Come on!
If there is still no response, you may have an opioid overdose on your hands. Check for signs of an overdose. Signs of an opioid overdose include blue or grayish lips or fingernails, slowed or no breathing, deep snoring or gurgling noises, pinpoint or tiny pupils, unresponsiveness to pain, unconsciousness. If one or more of these symptoms are present, telephone 911.
Hi, I think my boyfriend overdosed.
Cooperate with the 911 dispatch operator to get help on its way. In Michigan, you're protected from liability in the event you administer naloxone in good faith for an opioid overdose or call for help for someone who is overdosing. Stay on the phone with the operator. Once medical attention is on its way, it's time to move along to the next step. Intranasal naloxone. In order to administer naloxone, peel the intranasal naloxone medication. Place the nozzle into the nostril and push the plunger into the person's nostril. Remember, do not push the plunger until the nozzle is in the nose. No test spray is needed. The next step is to provide oxygen through rescue breathing, CPR, or follow 911 dispatch instructions until medical help arrives. The last step is naloxone again. Repeat naloxone every 2 to 3 minutes till the person resumes breathing or becomes conscious. Continue rescue breathing and/or CPR while waiting for naloxone to work. Stay with the individual until help arrives if it's safe to do so. If you must leave the person unattended, place the person in recovery position with their head tilted back slightly to open their airway, hands supporting the head, and the knee stopping the body from rolling onto the stomach. Ultimately, no matter what happens, you did the right thing because you responded. Remember to take action to save a life.